Interesting TCM and Acupuncture. Part 29. Interesting Pulse Diagnosis number 7. The results of modern scientific research. Research group leader Li Yongguan operated between 1996 and 2001. They used Huaning pulse-taking analysis methods to research 18,469 patient visits in the three basic positions of Cun, Guan, and Chi. They collected their research into the following categories: Cun, Guan, Chi analysis and location rules. 1. Left Cun is associated with the heart. Its pulse diagnosis is as follows. The left Cun pulse chart diagnoses the conditions of the heart. Left Cun pulse chart contained photos of 2,052 patients. There were 30 pulse presentations recorded. The heart illnesses included were myocardial ischemia, myocardial inflammation, coronary heart disease, myocardial infraction, angina pectoris, insufficient heart capacity, wind-damp heart illness, lung origin heart illness, high blood pressure, congenital heart illness, inflammatory myocardial conditions, tachycardia, bradycardia, premature heartbeat, changes in heart causing stasis, atrial fibrillation, etc. Heart chi vacuity diagnosis. Left pulse Cun position is weak. Heart blood stasis diagnosis. The left Cun position is astringent and hesitant, nodded, and it can also present with intermittent pulse in cases of heart blood stasis, which can help clinicians decide the nature of the illness. Note, the left pulse exhibiting deep and weak characteristics is a result of myocardial blood deficiency. 2. Right pulse relates to lung illness diagnosis. The right Cun pulse position is used to diagnose lung illnesses. The right Cun position had 1,917 photographs taken. There were 23 recorded pulses. Lung illnesses included acute trachea inflammation, chronic tracheal inflammation, lung collecting cough, lung qi distension. 2.1, wind heat attacking the lungs. Right Cun was fast. 2.2, lung qi vacuity. Right Cun position was weak and minute. 2.3, lung yin vacuity. Right Cun was thin and fast, or deep and fast, weak and fast, or minute and fast. Guan position principles. 3. The right Guan position is used for stomach diagnosis. The right Guan position had 2,057 photos recorded. There were 29 pulse presentations. Stomach illnesses include stomach cold, stomach heat, stomach blood stasis, liver and stomach stasis, stomach pain, stomach inflammation, surface level stomach inflammation, 12 types of large intestine leaking, stomach leaking, and stomach tumor. 3.1, stomach cold diagnosis. The right Guan position was slow. 3.2, stomach heat. The right Guan position was slippery and fast. 3.3, stomach blood stasis. The right Guan position was astringent, deep, and unregulated. Note, the right Guan position, when slow, shows stomach cold. When slippery and fast, shows stomach heat-related illnesses. Chi position principles. Chi position is used for diagnosis of kidney illnesses. Both sides of the Chi position were recorded, with a total of 3,233 pictures. There were 23 pulse types recorded. Kidney illnesses included were kidney inflammation, kidney basin inflammation, kidney rock accumulation, bladder inflammation, urethra infection, kidney ability incomplete, prostate inflammation, kidney-related high blood pressure. (4.1) Kidney yang vacuity pulse. The chirp position was deep and weak. 4.2 Kidney yin deficiency. The chirp position was deep, thin, and fast. 4.3 Bladder damp heat. The chirp position was slippery and fast. Bladder damp heat has many types of urinary retention and transmittal disease associated with it, including kidney basin inflammation, bladder inflammation, and so on. 4.5 Lower jiao damp heat. The chirp position showed wiry pulse. Lower jiao damp heat can be seen in urinary retention, waist pain, urinary stone, tongue red with yellow coat, wiry pulse, and stone urinary obstruction. Cun, Guan, and Chur analysis of sudden onset illness. 1. Cun position can be used to diagnose heart muscle blood deficiency. The left Cun position, when deep and weak, shows heart muscle blood deficiency and is a high-level diagnostic technique. Key point: in clinic, heart muscle blood deficiency is usually followed by other illnesses and can be treated early to prevent other problems. 2. The Guan position can diagnose stomach illnesses, and the right Guan, when slow or slippery and fast, indicates stomach illness. The right Guan position illnesses: stomach pain with stomach inflammation, 12 leaking conditions of the stomach and gut, including stomach cold and heat conditions. The Guan position when slow indicates stomach cold. The Guan position when slippery and fast indicates heat. Note: stomach is the root of the post-heaven. It has its own special adjustment feature in the body, which systematically changes according to specific principles. 3. The two sides of Guan are not equal. This indicates brain blood insufficiency. Left Guan, a bit wiry and damp, and right Guan, deep and weak, indicates that the brain blood is incomplete. It is important to catch it early. In clinic, this indicates other potential pathologies, so it is important to treat it early. 4. Chur position. Deep, thin, and fast pulse, or presenting as weak, indicates kidney vacuity. The chur position shows kidney vacuity. Kidney yang vacuity is deep and weak. Kidney yin vacuity is deep, thin, and fast. Kidney illnesses include kidney inflammation, kidney basin inflammation, kidney stones, bladder inflammation, transmittable urinary diseases, lack of kidney function, lymph inflammation, kidney-related high blood pressure. Interesting pulse diagnosis research materials. Pictured: contemporary Chinese medicine, study of the pulse. 5 organ differentiation. 1. Heart disease pulse. 1.1. The heart controls the blood vessels, heart fluid loss, and coronary heart disease. Heart yang vacuity. The chur pulse is fast, or if the heart fluid is not even, it can be knotted and intermittent. Typically, the tongue surface will be white. There will be heart palpitations, chest impediment with lack of breath. The face will be bright white. There will be muddle-headedness. There can also be an aversion to cold limbs, and so on. These cold symptoms are indicators of yang vacuity. Heart yin vacuity, thin and rapid pulse. The tongue is red with scant covering. There are heart palpitations, 5-palm heat taxation, tidal fever with thief sweating, and so on. Heart blood stasis. The pulse is thin and astringent, as well as knotted and intermittent. The heart controls the vessels, and illnesses indicate that the heart fluid has been lost. There is coronary heart disease, etc. Heart fluid loss indicates that the heart has developed some sort of impediment. In clinic, heart fluid loss shows with sudden increase of heartbeat speed, sudden slowing of heartbeat, sudden heart fluid dysregulation, sudden changes of heart speed, etc. These show in Chinese medicine pulse diagnosis as fast, slow, hesitant, knotted, intermittent, etc. From electrocardiograph and pulse image, the research showed slow pulse, sudden slowing of heart rate, sick sinus syndrome, junctional escape beat, etc. Fast pulse, frequently seen in sudden heartbeat speed increase, change in heartbeat location with speed increase. Astringent pulse, related to change in blood vessels. From the perspective of Chinese medicine differentiation, when the speed of the pulse increases in thin and fast pulses, it usually indicates insufficiency of yin and blood. Yin is minute and yang is flourishing. When the pulse is slow, in cases of slow pulse presentation, it indicates yin cold flourishing interiorly. This is the injury of yang qi. Yang does not ascend yin. In astringent pulse, it indicates qi stagnation and blood stasis. This usually results because of stoppage of qi and blood. In the case of coronary heart disease, it is frequently seen in heart vessel-related illnesses. In clinic, it is related to chest impediment and heart fright illnesses. If severe, the heart will experience local pain. 1.2. The heart controls spiritual awareness. The heart controls mental awareness, so when its function changes, it's normal for mental illnesses to occur. Chinese medicine holds that insanity, epilepsy, and madness illnesses result because of long-term liver qi stagnation, which causes inflammation and phlegm to attack the heart, and is frequently seen with wiry, slippery, and fast pulses. Slippery pulse indicates acute mental illness. The emotions and mental state change in chronic conditions. There is better efficacy in treatment. In wiry pulse presentation, it usually shows in mental changes. In chronic cases, this is a frequently observed condition. Typically in such situations, Chinese medicine has a high degree of efficacy. 2. Lung illness pulse. The lung is used to treat breathing issues, the qi of the whole body, defensive qi, and exterior syndromes. Illnesses, lung qi losing its descending ability due to external pathogenic attack on the lung, or phlegm damp stagnation. Usually, this is seen in cold and hot without sweat, cough with fast breathing, nose stuffed, and chest impediment. It's seen in exterior fever heat and shows with slippery, fast, and tight pulses. Lung yin insufficiency, short breath with lack of strength, cough with lack of sputum, speaking in a weak, low voice, easily catching colds, easily sweating on movement. With cough, it can show in floating, thin, slippery, wiry, and fast pulses. Water qi rises up and disturbs the heart. Heart illnesses originating in the lung. 3. Spleen and stomach illness pulses. Spleen vacuity shows with wiry and unhurried pulse. It's accompanied by abdominal distension, loose stools, exhaustion, forelimbs weak, etc. Chronic stomach inflammation. In clinic, it presents with lack of desire to eat, upper abdomen discomfort and pain, sighing, vomiting, and nausea, etc. In Chinese medicine, it is seen in liver and stomach disharmony and spleen and stomach vacuity weakness. Chinese medicine differentiation, liver qi stagnation, wiry and thin, or wiry and thin. Deep heat internal obstruction, wiry and slippery. Yin vacuity internal heat, thin and fast. 4. Liver pulses. Liver illnesses present as liver inflammation, failure to transform, liver tumor. These are all related conditions. From the Chinese medicine perspective, these are related to high blood pressure and liver illness. 4.1. Liver inflammation with acute characteristics often happens as a result of spleen and stomach, gallbladder and liver damp heat. Pulses present as slippery and fast. They can cause fever, loss of appetite, jaundice, liver inflammation, liver area pain, tongue surface yellow and greasy. 4.2. Chronic liver inflammation. Chinese medicine holds that this comes from liver qi stagnation and has a wiry pulse. This illness results in loss of strength, liver area distension and pain, abdomen distension, loss of appetite, tongue with a greasy coat. 4.3, liver fails to transform long-term illness. Liver and kidney are both deficient. Blood stasis and qi stagnation with deep, thin, weak, and astringent pulse. 4.4, high blood pressure, wiry pulse dominates. High blood pressure is a chronic illness, mostly related to the nervous system maladjustment or special circumstances resulting in high blood pressure. High blood pressure clinical norms. Before using blood pressure reducing medicine, there must be 3 times when blood pressure is higher than normal. Typically, this means that the blood pressure is 140 mm over Hg, or because in diastolic measurement it's above 90 in systolic measurement. These 3 tests must be administered on different days in order to verify the patient has high blood pressure. Note, you must take age into account when measuring blood pressure. Chinese medicine holds that high blood pressure is not a disease condition, but instead that it belongs to a Western medical understanding. High blood pressure from the Chinese medicine perspective can show in instances of acuity. High blood pressure in Chinese medicine shows with headache, dizziness, liver wind, and liver yang attacking upward. High blood pressure has some obvious signs, including relative age. People of a higher age are more likely to exhibit high blood pressure. High blood pressure relates to physical decline. Chinese medicine holds that this is an indication of the decline of the organs and viscera. This is from zhengqi becoming deficient. Normally, zhengqi deficiency relates to spleen activity and kidney vacuity, also blood stasis in some people. Patients with wiry pulse, with tongue and teeth dark in color, moving pulse, and some people with dampness and inflammation also experience high blood pressure. 5. Kidney illness pulse. Kidney illness usually shows with kidney yin or yang deficiency. It's common to see urinary retention and reproductive issues, with loss of overall function of the body. The kidneys rule the reproductive system, water physiology, and urination and defecation. In modern Chinese medicine, illnesses such as urinary retention and sexual pathologies are closely related to kidney issues. 5.1. Kidney yin vacuity fire blazing, kidney yin not sufficient, or heart and liver fire blazing all show fast and thin pulses. Usually this shows with tongue red with little coating, dizziness and unclear vision, face red with red eyes, heart vexation and easily angered, loss of sleep with many dreams, ringing ears and waist pain, etc. 5.2. Kidney yang deficiency, cold interior. The pulse is slow and weak. The tongue is light-colored and sensitive with light coat, aversion to cold, and loss of strength. Face is red and light white. Waist is sore. There is inflammation, loose stool and impotence, maladjustment of menstruation, inability to become pregnant. 5.3. Kidney vacuity with water overflowing. Water qi attacking the heart. Western medicine classifies this as coronary heart disease, indicating a loss of function of the heart. The pulse is deep and thin and astringent, or knotted and intermittent. The tongue is pale with light coating. There are heart palpitations, cough, swelling, and lack of urine. The 18 pulses which RAC and TCM students must master. 1. Fu Mai, floating pulse. 2. Chen Mai, sinking pulse. 3. Chi Mai, slow pulse. 4. Shu Mai, rapid pulse. 5. Hua Mai, slippery pulse. 6. So Mai, choppy pulse. 7. Shu Mai, empty pulse. 8. Shi Mai, full pulse. 9. Chang Mai, long pulse. The 9 pulses which doctors of RTCMP and RAC must master. 1. Wei Mai, minute pulse. 2. Ruo Mai, frail pulse. 3. Ru Mai, soggy pulse. 4. Ko Mai, hollow pulse. 5. Ge Mai, leather pulse. 6. Fumai, hidden pulse. 7. Laomai, confined pulse. 8. Dongmai, spinning being or moving pulse. 9. Sanmai, or scattered pulse. Thanks for watching.